2014, I kind of call it my lap around the sun that I'd like to forget. In probably October, I'd felt a lump on my right breast, and after about 3 weeks, it wasn't going away. So I said to my wife, I said, I think there's something going on. Can you feel this, and what do you think? So she felt my lump, and she said, I don't want to startle you, but I want you to make an appointment tomorrow with your doctor, which I did. I saw him within a few days, and on December 3rd, I was notified by oncology that I had breast cancer. It was 5.5 months of chemo and then 6.5 weeks of radiation. My father was 64 when he passed away of prostate cancer, and two of his brothers followed within the next 10 to 15 years. So there's definitely some cancer in our family. What's interesting is during my conversation with the oncologist, he had asked if I was Jewish, and he said the BRCA gene is prevalent in Ashkenazi Jews. So he said, I'm going to recommend that you get tested to find out if you have the gene. I was the first of many in our family to be tested for the BRCA gene. One of the two toughest things I ever had to do was to notify my sons who were living in other cities that I was diagnosed with breast cancer, and then 3 weeks later have to call them back and tell them, oh, by the way, I also tested positive for a genetic mutation that you both have a 50% chance of inheriting. One of my sons was tested within a year. The other one doesn't feel comfortable having the test. If my son doesn't want to know, it's not for me to force him to. At least they're both aware that if there's any change within their body, do not get attention right away. Just talk to a doctor and make sure that you're okay. If somebody young, late 20s, early 30s, if they know that they possibly have the mutation, there are tests that can be done at an earlier age than the general population. The one that comes to mind is the PSA test for prostate cancer. Normally, I think that starts in around 50. That can be done in their 30s. I think men are afraid to be tested. I think my rationale for encouraging them to be tested is not just because of them. It's because if they do have children, that you want to be able to at least give them the opportunity to know that it might exist. I've always felt that the more knowledge you have, the better, and the more proactive and preventative you can be with your health care is quite important.